Radiotherapy can cause side effects in the area of your body that is being treated. You may also get some general side effects. After treatment finishes, it may be 1 to 2 weeks before side effects start getting better. After this, most side effects usually go away.
The most common side effect that people experience from radiotherapy is tiredness, and that varies an awful lot from person to person. Some people might not notice it, other people can feel quite severely fatigued. What we'd suggest is that you listen to your body. If you need to take rest, but actually if you can take some gentle exercise each day as well, that would help.
This is a common side effect that may last up to 2 months after treatment. Try to get plenty of rest and pace yourself. Balance this with some physical activity, such as going for a short walk.
The other common side effect with radiotherapy is it's possible to get a skin reaction. That often happens towards the end of treatment, or it can happen a couple of weeks afterwards. We'd recommend that you keep the area well moisturised. What you might notice is the area gets a little dry, feels itchy, perhaps like a prickly heat sensation. In some people that can develop into a sunburn-like reaction, or even crack and peel. If that happens, please let us know, because there are creams and dressings that we can use.
Do not put anything on your skin without checking with your specialist or radiographer first. Have a cool or warm shower rather than a bath, and turn the spray away from the treated area. Pat the area dry gently. Do not rub. Wear loose clothing that is less likely to irritate your skin. And avoid exposing the treated skin to the sun for at least a year after treatment has finished. You may experience aches, twinges or sharp pains in the breast area and numbness to the upper part of the inner arm. Your breast and treatment area may feel different. If you have had surgery to remove your breast, you may notice some slight swelling along the scar or within the chest wall area. If you've not had surgery to remove your breast may feel swollen or tender, and you may feel some tingling or shooting pains within the breast tissue and some pain or tenderness around the rib area. This can be treated with mild painkillers like paracetamol if needed. These symptoms usually improve over time, but for some patients can persist long term. You may experience some stiffness in the shoulder or a reduction in the range of arm movements. This is more likely to occur if you've had surgery to remove your breast. It is important to do exercises to help maintain the movement in the shoulder. You may have been seen by a physiotherapist who has instructed you about exercises before you attend for your radiotherapy. This is usually just after surgery. It is important to continue with these exercises during and after radiotherapy, as they will help with achieving the arm position required for you to receive your treatment. Swimming offers excellent exercise for the arm and may help reduce stiffness of the shoulder. You may go swimming if your skin is not blistered or peeling. It is best to shower immediately afterwards and then apply moisturiser. If your skin becomes irritated or you get any broken skin from the radiotherapy side effects, please stop swimming until it has healed. Your radiotherapy team will explain what to expect and give you advice on managing your side effects. Always tell them about your side effects. There are usually things we can do to help.
Patients tell me the treatment is like having a simple x-ray done, so it is not an invasive treatment per se. It does target some of the deeper tissues. Again, that will depend on your type of cancer, and you'll be advised of that. But it's not like chemotherapy treatment. You will not lose your hair when you're getting breast radiotherapy. For most patients, it doesn't make you feel sickly at all. For most patients, it is a superficial treatment with localized and relatively mild to moderate symptoms.
We appreciate when you come for your radiotherapy, you've had a difficult time, the cancer diagnosis and treatment following that. Please, if you've got any questions, do ask the staff. The radiographers are all well trained and used to answering questions each day. So any questions, please do ask. Also, if you require any support during your treatment, again, do let us know.
Long-term side effects, known as late effects, can occur months to years after radiotherapy. Most patients who receive radiotherapy to the breast experience minimal or mild side effects, which do not interfere with everyday activities and have no long-term damaging effects. These late effects are the hardest to predict. Your oncologist or specialist radiographer will explain the potential late side effects of the radiotherapy to you as part of the consent process. We plan the treatment to avoid the surrounding areas around the breast and chest wall area as much as possible to reduce these side effects.
After the treatment, there can be some subtle changes. The radiotherapy actually has quite a prolonged recovery period. Again, most of these are very subtle. Patients with an intact breast often find their breasts just slightly swollen for about 6 to 12 months afterwards, and then as the years go on, that sort of fluid, what we call fluid retention, settles down, and the breast is just slightly firmer than if they hadn't had the treatment, sits slightly higher than if you hadn't had the treatment. Sometimes patients notice the skin slightly dusky in discoloration, and certain patients can have some localized areas where you can have slightly visible little blood vessels on the superficial tissues in a small area. Most patients don't notice a big difference in the long-term cosmetic impact of the treatment on their breast.
The most common side effect is the way the breast looks and feels. The texture, sensitivity and shape of the breast may alter. The breast can feel firmer or more tender. The breast can change its size and shape, and there can be changes in skin colour. Very rarely, radiotherapy can cause heart or lung problems, or problems with the ribs in the treated area.
When we give radiotherapy in this setting, there often is a small amount of radiotherapy to the underlying tissues, which is the lung tissue for most patients. And for patients with a left-sided breast cancer, there can also sometimes be a small amount of heart tissue. And this is all measured out and calculated with the CT scan. Now, for the vast majority of patients, the volumes that we're talking about and the doses that we're talking about are really small and unlikely to have an impact on your health in the future. Again, this will be discussed with you in your consultation and always balanced against your benefits of the treatment as well.
If you receive radiotherapy to your lymph node areas as part of your treatment, or if you've had surgery to this area, there is a risk of developing lymphoedema. This is a swelling of your arm on the side where the cancer has been treated. It is caused by damage to, or removal of, the lymph glands under your arm, which are responsible for draining fluid. Treating nodal areas can increase the risk of lymphoedema developing in later months or years. Approximately 20% of patients will develop some degree of swelling. Swelling can occur at any time. Taking special care of your hand and arm on the side where you've had treatment may help to reduce the risk of this developing. There is a small risk of developing shoulder stiffness when treating the lymph node area. This is due to scarring of the tissue around the shoulder joint. There may be some restriction in the range of your shoulder movement on the side where you've been treated. Regular exercise will help. Your breast care nurse can provide you with information on helpful exercises. These and using your arm normally will help you keep your shoulder more flexible. Also, in the longer term, you may get a dull ache or shooting pains that last for a few seconds up to a few minutes. You may notice the treated area becomes swollen. The effects usually improve quickly after treatment. You may still get aches and pains after your radiotherapy has finished. If you've had your lymph nodes included as part of the treatment, radiotherapy can cause damage to the nerves around the treatment area. This can lead to pain, weakness, altered sensations, including numbness and pins and needles, as well as restricted movement to the arm and hand on the treatment side. Radiotherapy is associated with a very small risk of developing a secondary cancer many years later, 10 years or more, in the treated area. In non-smokers, the risk is usually less than 1%, which is much less than the risk of not treating the breast. If you're a long-term smoker, the risk is larger, around 2 to 5%, but you can greatly reduce this risk by stopping smoking. Improvements in radiotherapy planning and the way in which radiotherapy is given mean that long-term side effects occur less often. Only a very small percentage of people will develop even one of the side effects. Please visit the Northern Radiotherapy Network website if you have any questions or queries.